With our hospital today, we have a lot of us. I had to learn an awful lot. We have the hospital, and then we have the hospital district. Two different entities, and the district is run by the county. Basically, it's a county district with mill levies and taxes to operate the facility, and then the hospital is the function. So we have, we have with us today the CEO, which is Kent Rogers right over there, and he's with the hospital. And with the district, we have Bob Wagoner.
Dexter was just trying to explain the very confusing thing that we have two boards that manage the hospital. One of the boards, the board that I sit on, the Montezuma County Hospital District, it's a special district, and we own the property, and that's all we do. We then turn over the management of the hospital to the Southwest Health Systems Board, SHS Board, and to the CEO, Kent Rogers here. So there's those two separate boards involved in the running of the hospital. The sales tax proposal that's on your ballots, and I'm hoping to get my second ballot so I can vote another. The sales tax initiative on the ballot is being sponsored by the hospital district board, and we're asking for a 0.4% sales tax for the county. I'll get into some details about that, but I want to turn it over to Kent here for a minute to talk about what we want to do with that sales tax.
Yeah, thank you, Bob. Can you hear me okay? So a lot of people have questions about the two boards and how we interact and who does what and why there are two boards. And that we could have a cup of coffee and I could give you a full morning lecture about that sometime. But probably over the last 20 years, there have been a lot of developments where governmental entities have had a lot of restrictions that have imposed, curtailed, limited what they could do, especially in health care. For example, Montezuma County Hospital District is restricted to the county boundary. And when they got into this dilemma back in the late 90s, they wanted to open clinics in Dove Creek and up around Telluride and places like that. But they were doing that illegally because they were not allowed to go outside the county. So spontaneously in '96, Southwest Health System was created so they could reach out and do some more innovative things. What we see healthcare doing today. So, okay. But if you're interested in that, I'll leave my contact information and you can get in touch with me, and I won't bore the rest of you with the details. So I'm new to Colorado. I'm originally from Tennessee. That's why I sound funny. I wanted to do this my whole life. In fact, when I was in high school, I knew I would be a hospital administrator when I grew up. So I've been in healthcare for about 25 years. I'm 50 now, so about half my life. And I've been a CEO for about 12 years of that. I want to tell you a couple of quick funny stories and then get into the project. First of all, healthcare is something that nobody really wants until you absolutely positively don't have any other option, right? And so I speak to a lot of civic groups and I say, I've got a door prize for whoever pays the most attention. And yeah, it's a colonoscopy. Who wants it? Right? I didn't want to get the phone call that my daughter was in a car accident and have to drive 3 miles out into Pontotoc County, Oklahoma, seeing the blue and red lights flashing out in the horizon, knowing that my daughter was the victim of that car wreck, right? But knowing it was a great hospital there was because I was a CEO, of course, in that community. I knew that my daughter was going to be well taken care of. I didn't want her to have to go 30 miles away for health care. So health care is very local to us, and it's something that we don't really appreciate until we have to have it, right? So nobody thinks they're going to have a heart attack, and then they're having chest pains. The next thing you know, they're on the floor. How far do you think they want to go to get good heart care? The answer is not very far, right? And so good health care, good local health care is something that we take for granted, but it's something that we all truly want. But we don't want to think about it until it's practically too late. The other story I want to tell you is I was speaking to a group of ladies Saturday before last, and they were going around the room introducing themselves, and every one of them had an interesting story. It turned out to be they were all good stories, so I was lucky that morning, about their most recent experience with Southwest Health System, our local health system here. And that really affirmed to me that health care is something that's very personal to every one of us. Not necessarily a building with an expensive CT scanner and stuff like that, but however that's provided, whether it's through a physician or whatever, it's something that's very personal to us, right? It's like part of our family. And I've spent my whole professional life working in small communities. I grew up in a town of 5,700 people, and I was a home of a 35-bed hospital. The first CEO job I had was in a 60-bed hospital. I worked in a bigger hospital, and it's not really what I care to do. So this is the first critical access hospital I've worked in. We're a very active organization, and to be only 25 licensed beds, which is what we're limited to through our critical access designation. So I want to tell you three things tonight. I want to tell you what we're doing, why we're doing it, and then finally how we're planning on doing it. And with each of the whats is a why, okay? So the first part of that what, and I'm sure you'll have a lot of questions about this, and we won't have time to answer them all tonight. But the first part of the what is a new inpatient facility. The current facility that we're in now is 40 years old. It is outdated. It's been well maintained. If you walk through it, you probably don't recognize that it's 40 years old. We've upgraded the finishes in the rooms, but the infrastructure is old. Now, that's not old to you and me, but for a building with today's mechanical systems and IT and things like that, it's just gotten to near the end of its useful life. It's a little difficult for us to go in and renovate in place. If you can think about redoing your kitchen in your home, how many meals do you think you cook while you're renovating your kitchen? None. How would you like to be a patient in the hospital while we're renovating the floor that you're being cared for on? A lot of infection control issues around that, and it's just not feasible for us to be able to do that. One of the biggest dilemmas of my job is when we get ready to renovate an area, we have to find a new home for that's being renovated while we renovate the spot that they're in. So we play this magic shell game of moving stuff around. That's why it's so hard to find things in hospitals. You think we do that on purpose, but it's just the way that we have to juggle things around. So the inpatient facility, pardon me just a moment. The inpatient facility that we are drawing, that we have drawn, and we have actually hired Nunn Construction as our general contractor and construction manager. Mchd has. We've been working with Davis Architects, and I know this print's too small for you to look at. You're welcome to come up afterwards and see it. This is a 20-bed inpatient wing, which is on the northeast corner of the current hospital. So if you can, Mildred Road is over here where my hand's moving up and down, okay? And so this is up to the north. So a 20-bed inpatient wing with intensive care unit here on the far end, and labor and delivery here, because we do have a pretty active birthing program at Southwest Health System. Deliver about 200 babies a year. The rest of the rooms in there are what we call med-surg, medical surgical. So if you're not having a baby and you're not in intensive care, you end up in one of those other private rooms. So this is a 20-bed replacement addition, a new entrance lobby here, only to make patient flow and visitor flow easier, because a very expensive part of our hospital is on the ground floor, and that's this internal core here, which includes radiology, surgery, ER, and also our laboratory. Very expensive space, a lot of expensive equipment. And so we're not planning any major renovation, any renovations to this. So a new lobby, which is actually just an expansion of, it's on this one, which is just an expansion in place of the existing. And this is an elevation from the architects looking from the northeast back towards the southwest. So there's a canopy drive there, and this is in pretty much the same place. So we've gone with a little bit simpler design there, but a little bit more of a modern look to it. And then for circulation, to go into the inpatient area, you'd come in the front door, you walk down a glassed corridor, and then immediately into the new inpatient wing, okay? So lots of reasons why, but renovating in place, the cost to renovate, it's actually cheaper for us just to build new. The second component of what and why is emergency medical services. My story about my daughter being in a car accident and having an ambulance authority, an ambulance service that was part of the healthcare system that I worked with, let me know that we delivered good emergency medical service care. And that's the case here in Montezuma County. Southwest Health System operates the emergency medical services with EMTs and paramedics. It's a high-quality service. It's accredited. We want to build them a garage facility, a home for EMS on the hospital campus. So some people have said, well, what's wrong with what they've got now? Well, the answer to that is they don't have anything right now. Our ambulances sit out in the weather. When it's too hot, too cold, we have medications on board, so we have to idle the engines to keep the internal temperature so the medications don't spoil. And they don't have a home. And so we want to do something to extend the life of those ambulances because they're around $200,000 a pop when we have to replace an ambulance. So we wanted to build a facility on the hospital campus in order to accommodate them. And the third and final part of the project is a medical office building on our hospital campus. If you have been to one of our affiliated clinics around town, there's a chance that you might have gone to the wrong location. It happens every day. We have someone that's going to see Dr. Baggy, and they go to our clinic on Elm Street, or they're looking for Dr. Smith, Cameo Smith, and they go to the Annex on Market Street or something like that. Our physicians and mid-level providers are scattered around town. We have a lot of duplication in resources, lots of extra waiting rooms instead of consolidated waiting rooms and check-in staff and things like that. And we want to consolidate them into a common medical office building to be constructed on our hospital campus. There are just lots of efficiencies that go along with that. It's better for patients because we don't have to worry about you getting lost downtown. And then also for patient referrals. If you go in to see your primary care physician, you need to have a referral to a podiatrist for, you have diabetes and need a foot, not an inspection. I'm sorry, just escaping me. But if you need to have a foot consultation, they're right there in the same building. It just makes a lot of sense for us to be able to do that. So those are the three major parts of the project that we're asking for the sales tax referendum to help fund. Okay? So a little bit about fundraising for this, and because this is an expensive project, it's actually a three-legged stool, if you will. We have local initiative. We have already asked, and for about the last 16 months or so, a capital campaign that's raised a little over $350,000 just in donations for people that are giving money to the project. We had the car raffle. Some of you may have bought tickets for that, and so that was part of our fundraiser. So we've had the capital campaign. The second leg of the stool that we've reached out to is through a DOLA grant, an energy impact grant. And we'll be going on the 17th and 18th of November up to Grand Junction. We're making a $2 million funding request to DOLA to help fund the project. And the final and biggest portion of it is, of course, Initiative 5A on the ballots, and that's the sales tax referendum. So I'm going to let Bob have the mic back and explain more about the whole sales tax initiative, and then we'll see what questions you have. Okay? Yeah, so actually we don't have a final cost right now. We have just engaged Nunn Construction, and we just got design documents from the architects last week. So we're just starting to initiate the pricing with subcontractors. So it's a moving process as we go along. Does that make sense? Okay.
Well, the sales tax, which I promised to tell you a little more about, I was a little surprised how complicated the sales taxes are in Montezuma County. If you live in Cortez, you are now paying sales tax to two different jurisdictions. The state of Colorado collects 2.9% sales tax, but the state sales tax exempts some very important things. It exempts groceries, it exempts prescription drugs, it exempts utilities, and it exempts non-licensed farm equipment. That's the state 2.9% sales tax. However, if you're shopping in Cortez, the city of Cortez has a 4.05% sales tax, and there are no exemptions. So the next time you're at City Market, look really carefully at that printout that you get from the cash register, because it actually says on there sales tax A and sales tax B is the way it's described on that receipt. And that's the city and the state of Colorado. Now what we're proposing is a third sales tax jurisdiction. The Montezuma County will be the area that this tax will apply to. It will be 0.4%, which is 4 cents on $10. So if you spend $10 anywhere, any retail establishment in the county, you will pay 4 cents on that $10 to pay for these upgrades in our hospital. It's a very small tax, and our board decided to do it this way because if you think about it, travelers to Montezuma County who occasionally need health care, anytime they buy something in Montezuma County, they will be helping to pay for these additions to our hospital here. So the sales tax is applied in Montezuma County, but anybody who's traveling here will pay it. And in the summer, I've heard the figure, and I don't put this in the newspaper, but I've heard in the summer when there's lots of tourists, 65% of the sales tax that's collected in Cortez is being paid by visitors, not by residents in the county. And of course, in the winter, that ratio would go down as the number of travelers goes down. But the point is, we're going to get some help from people outside of our county to pay for this. So that's, and the final fact is, the tax that we're proposing mirrors the Colorado sales tax in that groceries, drugs, prescription drugs, not marijuana, groceries, prescription drugs, utilities, and farm equipment will not be taxed by the tax that the Montezuma County Hospital District is asking for your consent. You mentioned being taxed without consent. Well, we're here asking your consent for a 0.4% sales tax. So that's my little spiel. I'd be willing to tackle a question if you have one for me. Yeah. Give that guy the microphone.
I have several, probably a little bit rapid fire, if you don't mind.
Go for it.
How much is what is the cost of the indigent care for Southwest Hospital, and how does that compare with the other hospitals in this area, i.e. Mercy and San Juan?
Yeah, I'm not sure how we compare because I'm not sure how we compare. If you give me just a moment here, I'll look up the number that we've incurred so far this year. I'm still a little new of memorizing those numbers. But just along those lines, Colorado being a Medicaid expansion state, it's the first expansion state that I've ever worked in, has been a benefit to smaller community providers. We typically have a higher percentage of uncompensated care, mainly because people either don't take the initiative to enroll in Medicaid type programs, or that just, people passing through and aren't eligible for it. So I'll look up the number here in just a moment, okay?
How many of the other regional hospitals, that i.e. Mercy or San Juan, how many of those rely upon sales tax or property taxes in order to meet their obligations?
I believe Mercy's is all is corporate money, either corporate bonds that are issued by Centura.
You're correct in that, yeah. And you do not know about San Juan.
I know San Juan did a bond issue several years ago. I believe that was a revenue bond structure, was the last one that they did.
But that was a revenue rather than a property tax or sales
Yeah,
tax.
it was. We call those internal bonds, where they pay for them back out of hospital operations.
Correct.
Yeah. Part of the reason that the payer mix that we have, this is a relatively poor part of the state that we reside in, and the payer mix that we have, meaning the proportion of patients that we have that have the means to pay for care or good insurance that typically pays us better. We have a disproportionate share of Medicare and Medicaid, which tends to pay us less, and we just don't have the ability to fund the project out of internal operations.
So in essence, what you're asking the taxpayers to do is to pay for indigent care, because because the other hospitals in these areas, they're not reliant upon taxpayer subsidies in order to meet their needs. They're able to do it out of operational funds.
I'd agree with that partially. Yeah.
Okay.
Yeah.
A correction to what you were indicating. Now this may have changed, but I don't believe so. But in the mid to late 90s, and the amount of sales tax collected by tourists was 12%. That was a study then.
Statewide? Statewide?
That was in this area. I don't know if that's changed. I doubt if that would change dramatically the amount.
I don't have any hard numbers on that. That number that I quoted was more in the category of a rumor. But the point is still valid, that in the summer we get a lot of revenue in Montezuma County sales from people who don't live here, and that's the point.
That's where you're stealing money from. I don't care. You're stealing money from somebody. Now, when you indicate that you're asking permission for people, in a free society, people who buy a product, whether it's health care, food, or any other goods or services, they do so voluntarily.
Sure.
So to the extent that you're trying to get taxpayer subsidy, what you're basically doing is circumventing the free market that's already told you, no, we're not going to utilize and pay for your services. So what you're doing is going through, as being a governmental entity or a special district, you're going through and utilizing taxpayers in order to meet what the free market has already told you, no, we do not want to give that to you.
That's one way to look at it. The other way to look at it is we have taxes so that we can do things as a community that people don't do individually. We all admit that we might someday need health care, and so when you go to the store and buy something and there's a small sales tax associated with that, I think that's a concession that I'm willing to make, knowing that I'm going to need health care someday. So it depends on, you see it as an imposition on your freedom. I see it as a good investment.
So pay for it yourself. Why ask somebody else, another taxpayer, to do it? If it is voluntary, as what you're trying to indicate.
It's voluntary, you get to vote on it. That's the point.
Okay, so we'll say you win this thing, and you win it by 51% of the vote, and 49% say no. Now, given to the fact that probably only 20 in an off-year election, only 20% of the electorate are probably going to vote for it. So, is the 49% that say no, are they able to not pay this?
Well, that's just not the way taxes work. You know.
That's right. It's called theft.
Well,
Theft. Can you say theft?
I don't see it that way.
Okay, I know you don't, because morally you probably were educated in a public school and raised upon that theft is okay in our society, and that's
okay, so we'll disagree to disagree. Are there other questions?
One other question.
Okay.
Who is a bond issuance on this? Is it George K. Baum?
Boy, we haven't issued any bonds yet.
No, who would end?
It's like St. Mary's and Grand Junction.
St. Mary's and Grand Junction is a level 2.
Is that better?
It has more advanced care.
Okay, that's what I meant to say.
Yeah.
So, I mean,
how long does it take to get there?
Yeah, how long does it take?
So the answer is it depends. It depends on who else needs a chopper at that time. I know to fly to Farmington on the chopper from San Juan is once you're loaded and airborne, I believe it's about a 25-minute flight. The chopper has to get here, and that depends on weather also.
Yeah. Well, I'm just saying, I don't know what this is going to cost, but what's the price of a chopper to airlift us to Grand Junction? I don't have a clue. I mean, I'm just saying, are there other alternatives? That's the only thing. Have you looked at any other alternatives than just building a facility? I mean, what's the bed count right now? Average bed count per day?
Our average daily census?
Yeah.
12.
How many beds do you have?
We have 22 beds right now.
Okay, so now we're going to build another wing.
Taking the 22 out of service and replacing it with 20.
Is this going to be a second story?
This will be on the ground floor.
This will be on the ground floor? Okay.
Yes.
Somebody had told me one time that it was a second story.
That's not correct.
So you're only going to have 20
beds.
Are you tearing the facility down and rebuilding them?
No, sir. We'll utilize the second floor for some other patient care services that are currently on the south campus, which is the old nursing home.
Oh.
Physical therapy, infusion therapy, cardiac rehab, things like that.
Because, I mean, let's say a helicopter, how much is this going to cost when it's all said and done?
This projected for the inpatient that I showed on this chart, we're expecting around $16 million for this.
Yeah, it seems like you could have a standby chopper in a facility that you just open the doors, wheel it out.
Never seen a healthcare system that could operate that way, where we flew everybody out of town for care, because there are a lot of people that don't need that higher level of care.
But yeah, I just don't know why we need an upgrade, such an upgrade. But I mean, since we have modern technology, I mean, 100 years ago, it'd take you longer to get to town than, it'd take to get to Grand Junction or Utah State. I don't know if you fly any people up there or not.
Not that I'm aware of, no.
Oh,
okay. The infrastructure that we have for the current hospital does need upgrading, and that's the impetus behind the biggest part of this renovation. Absolutely. Yeah, this project's been, I don't remember the numbers off the top of my head. This has been analyzed since going back to about 2005, 2007. Yeah.
So how much was the cost to renovate?
Yes, sir, I don't recall that off the top of my head. Yeah.
But the other problem was, because Ken pointed out, was renovation. You can't do an inside renovation. I mean, how do you take care of the patient while you're rebuilding the patient's room? Well, Ken said you only use half. Well, that's the average. He said he gave you the average census. That fluctuates. You get to that average because you have more than that sometimes and fewer other times. So, okay, well, are you a pilot? In fact, I own a business. Next question right here.
You may have said it, but if you did, I missed it. Am I right that this is going to sunshine? And what?
Something I should have said. The sales tax that we're proposing will sunset in a maximum of 15 years. If we pay off the loans before that, it will sunset before that, but 15 years is the max.
So back, I'm sorry, Mr. Gill, back in May of this year, my mother went into respiratory arrest. She was COPD, never smoked the COPD for years, and she was having some real difficulties that morning. My father wanted to take her to the local hospital. She didn't want to go, so he called the local ambulance there. When she got to the local emergency room, which was just a few blocks down the street, town of 5,700 people. She went into respiratory arrest, and they coded her there. We ended up pulling the plug on her a couple of weeks later, so the outcome was the same. Without those emergency medical services available locally and an emergency room to stabilize her, there would have never been that opportunity for us to have that decision with her, because care would have been so far away. 662-bed hospital that's probably 40 miles away. To mobilize a chopper, even to get an ambulance en route, it just doesn't work. So sorry for that commentary.
No, the place is going to kick us out of here in about 5 minutes. So why don't we, while I clean up here, and a couple of us clean up our stuff, you buttonhole these guys, Mr. Preston and Mr. Rogers, Mr.